are you here for your cranial nerve exam? Yeah. Can I please just get your name and your address? Postcode, your mobile number, and for what reason did you want to do a cranial nerve exam? Okay, so just a general checkup. Yeah, that's fine. Just wondering if you're allergic to anything. Okay, great. So just to start off, I'm going to test your sense of smell. And I've got a couple of scents here. And I'm just gonna ask you to tell me what you think it smells like, alright? So just hold out your wrist for this, and I'll spray it on your wrist, and then you can smell it and let me know what it smells like. Okay, ready? There we go. So what does that smell like? Yep, that's right. And now the next one. Okay. Again, just put out your wrist. What does that smell like? Do you want to smell the lead instead? Might be a bit easier to smell. What does that smell like? Yep, okay. And finally, I've got one more scent. What did that one smell like? Okay, great. So far I think you're doing quite well for the smell test. Okay. Next, I want to test your vision, and we're going to focus on distinguishing some colours. So I'm just going to show you. Here we've got a couple of different pictures of dogs, and I'm going to go through and point out different pictures, and you tell me what colour it is that I'm pointing to, alright? Okay, so let's start with this one. What colour is that? Okay, and what about this one? This one has two main colours. So this colour. What about this colour? Great. What about, what's the colour of his bed? Great. And then what about, this one might be a bit hard to see, but what about this one? Great. And there's a can of dog food here. What colour is that one? Great. And then we have this collar. What colour is that? Great. Okay, so I think your ability to distinguish colours is fine. I just want to test as well your ability to read some different words and numbers. Just a second. Okay. So, can you read for me the words that I tap on? So, what does this say? Great. And what about the word below it? Okay, great. Let's go a bit smaller. Let's go with So what does this pink word here say? Okay, great. And what about this? Yeah, getting a bit harder to read, isn't it? Okay. Just write some notes. Alright, so now we're going to do a taste test. And the first one, just close your eyes and I'll put a sample onto a tasting stick and I'll place it on your tongue and you can just tell me what it tastes like, okay? So tell me, what does this taste like? Great, okay. Yes, that is vanilla. Now the next one. Okay, what does this taste like? Yep, correct, that is chocolate. And then the last one. What does this taste like? Yeah, that is just plain sugar. Right, you can open your eyes now. Now, so we've tested your taste, your smell, your vision, and now we want to test your hearing. What else is there? There's hearing and touch. Yeah. Okay, yeah. So let's test your hearing. So I'm going to make a series of taps, and then I just want you to tell me how many times you heard that tap. Okay? Let's start. Yep. Yep. Great. So I'm also going to see at what point you stop hearing a sound. So I'm going to create a sound, a tapping sound again, and you tell me when you stop hearing that sound, okay? Okay. So just tell me when you stop hearing it. No? Okay. No? Okay. I'm going to do it now with a different pitch, I think. Very good. Pitch. Okay. Okay. No? You can't hear that? Okay. And one more. You can't hear it anymore? Okay. Okay. This one again. You can't hear it anymore? Okay. So I'm just going to make some notes here. Okay, so we've got one more test. Okay, one more test, which is the sense of touch. And I just want you to tell me whether when I place this tool on your skin, I'll get you to close your eyes when we do this, and you just tell me whether I am placing the sharp end or the dull end, okay? So does it feel sharp or dull? So close your eyes. And is this sharp or dull? Okay. Sharp or dull? Okay. Sharp or dull? And sharp or dull? Okay. Sharp or dull? And sharp or dull? Okay, that test was fine. So most of your tests were fine, except I think there was certain sounds that you could not hear that well. So what I'm going to do is I'm going to write you a referral to see an audiologist or a hearing doctor, and you can get a more extensive hearing test. Okay, so I'm just going to write that down for you. Did you have like a preferred specialist, or is that something you wanted to come back to me with, or would you like me to make a recommendation for you? Okay, so I'm going to refer you to Dr. Michelle. I usually refer most of my patients to her. She's very good at what she does, so you'll be in very safe hands. I'm sure it's probably nothing significant. What we found was not that, not that severe, and it's pretty normal at your age for your hearing to change a little bit. So it's probably all normal. Right, so I'll give that to you. Here you go. And you can just take that referral and make an appointment with Dr. Michelle. All right, thank you so much for your time today. Have a good day.